Plantar fasciitis, in other words, irritation of the connective tissue in the sole of the foot, can be really troublesome and may become a long-term issue. But you are here now to get the best exercises for the maintenance and rehab, and that is exactly what you will going to get from this video. When stretching the plantar fascia, push the heel bone downwards with the other hand, while other hand lift the toes significantly upwards, and then you try to lift the ankle upwards, so that the response spreads in the sole area. Stretches can be held in segments of 20 to 30 seconds with the repetitions of the duration of the one song. What is an easy way to stretch the calves? Surprisingly, towel can be absolutely incredible good aid in here. Throw the towel under your foot when you are sitting in sofa, for example. When the towel comes under the foot, then grab the other end and start flexing your ankle upwards and let your toes turn properly towards you. After this, you can pull the other end of the towel and voila, an easy stretch. If you want to more stretch in the sole area, then the direction of the pull changes with the more horizontal towards your shin bone. Again, 20 to 30 seconds repetitions in here, and it can be done duration of the song. When the calf feels like they are stretched a bit better and you want to do this stretched by standing, then incline surface is really your friend if you want to be super lazy. For example, this is this kind of ischias or sciatic board, and the angle is about 30 degrees upwards. If you put your both feet and start moving your center of the gravity forwards, then the both superficial calf muscles, gastrocnemius, are going to be in stretch. If you want to more stretch to the soleus muscles, then you will going to bend your knees, feet, knees and hips in straight vertical line, and then push your knee forward long way. Suddenly the stretch starts to feel at the lower part of the calf, so the stretching is directly going to the soleus muscle. Standing against the wall, a stretch can be achieved like this. If you want to stretch the left leg, put it behind, with the foot slightly rotated to the midline, straight head or slightly out. With this, you can influence where the calf stretch is felt, and these patterns should always be direct to the structures where the strongest tightness are felt. After this, opposite left comes in front of you, or the other leg if you want. Cross the midline and keep the heel at the ground and start moving weight forward, so the calf stretches. If you want to easily stretch the both legs, then take this caterpillar position. Palms on the floor, walk your hands forward bit and then start popping your heels towards the ground with your knee straight or bended. If you need to get compounded calf and sole stretch while standing, then make thick cake out from the towel. This lift the toes towards the ceiling, and then with the stretches, for example standing against the wall, do the stretch and it's going to be at another level. With these instructions, 2/3 of the people will going to have their symptoms calm down for the most part. But if you encounter a situation when some symptoms remain in the foot area that do not change as the result of the stretching alone, then you need to know these exercises. If the mobility of the foot is incredibly terrible good and the foot symptoms intensifies towards the evening, then more strength needs to be added to the sole and the calf area. Strengthening in the sole can begin by pulling a towel flat on the floor. The heel stays in place. The intention is to pull with the toes as deep as you can, so you will going to activate these important structures. Roll the towel into the tight cake and then you start pushing the towel away under the sole by extending your toes. This spreading trains the small muscle in the foot that keep the foot structures firm and well controlled. Just do a lot of training on the symptomatic foot, and through the increase in strength, the load-bearing capacity of the sole increases and the symptoms gradually begins to decrease. What is important to remember in strength training? When you start increasing the training, keep the small diary of the intensity of the symptoms. If one day you will going to experience in a scale of 0, no pain, 10, the worst pain ever, for example 2 out of 10, do your exercises in the evening, and then the next morning is received by pain of 6 out of 10, that is a sign that the progressive has been too rapid or too fast. Calm yourself down. What about the pain during the training? If it stays at the same pain scale below 5 out of 10, then you can go for it as long as the pain doesn't intensify during the training. However, the most important thing is the morning pain, just like we previously talked. If we consider the footwear in this alignment, a hard, firm sole structure may temporarily elevate the symptoms at the beginning. But in long run, we should offer the foot as many different stimuli as possible so the function will be present in long run. For this reason, at the end of the video there is a recommendation for a barefoot shoe video. Well, now that we are going to combine the cooperation of the plantar fascia and the calf muscle, the surest way to start is with the isometric training. That is, we hold the position still with the muscle work. Why such training, you might ask. This tension without the movement is the best way to train the firmness of the tendon and the muscles. And this can be also done if desired from certain joint angles, whereby we get a huge increase in strength in that particular joint angle. But now we will going to make this progressive thing which you can start. The intention is to move to the more challenging exercises if the resting pain in the next morning has not intensified terribly. Phase 1. Stationary holds. Place the tip of the feet at the stair step or similar. Lighten the other leg, so the symptomatic leg does the stationary hold. Here it's worth holding the position for 10 seconds and then take the load onto both legs. And then let training leg to be rested a bit. Phase 2, toe raises. Here we want to lift the big toes and toes off from the symptomatic foot slightly upwards and the lift are initially down in a flat surface. If the workout are too heavy on one leg, do them with the both legs and move to the heavier and heavier training. Phase 3, toe raises with the large range of motion. The progression of the training leads to this, meaning we want to train the largest possible range of motion. Lower the heels significantly and try to lift yourself high as possible. And just like in walking, the toe raise needs to be enhanced between the first and second toe. So think about the pushing of the foot into the air with the surface between the big toe and second toe via the heel bone. Alternative to previous toe raises, you can do this with the ball between the heels. Take the support from the wall and do the toe raises with the ball feel while squeezing the ball with your heels. Make sure that you will going to go high as possible in the range of motion. It's important to remember that in this alignment that miracle does not happen overnight. If it's the mobility is the issue, then we need to be improved that. And probably as a result, the symptom starts to calm down. But if there's a absolutely crazy mobility present in the feet area, then the strength is what we need. So, as the saying goes, can go raw by going strong. Press here to the barefoot shoe video.